After a day where the average just got simply obliterated, I think it's worth focusing on a smaller drug company with a stock that actually managed to go higher this session. That's what these next-gen pharma companies are all about. I'm talking about Horizon Pharma. That's HZNP for all you home gamers. A company that targets unmet medical needs across primary care, specialty care, and orphan diseases. Horizon currently has 5 drugs on the market here in the U.S., and it picked up 4 of them via a series of smart acquisitions over the past few years that have really been additive to revenues. The company sells Vimuvo and Duexis for arthritis pain, Pensad for osteoarthritis of the knee. I could use every one of these drugs. Actimmune for a number of orphan diseases, and Rayos, which is a time-delayed prednisone treatment for rheumatoid arthritis. Horizon has a history of acquiring drugs or entire companies and then growing their sales much faster than anyone expected. Most recently, they bought Pensad from Nuvo Research last October. They acquired Videra Therapeutics to pick up Actimmune for $660 million last September. Before being snapped up by Horizon, Pensad had a failed product launch, even though it's superior in many ways to competing products. But Horizon relaunched it earlier this month, and it could have a lot of upside. Meanwhile, Actimmune could actually be worth ultimately more than $500 million in peak sales because of its many orphan disease applications. Now, Horizon has rallied more than 30% just since the beginning of the year. And while that's a big move, I wouldn't be surprised if it has more room to run because it's fitting what this market wants. So let's take a closer look with Timothy Walbert. He's the chairman, president, and CEO of Horizon Pharmaceuticals. Find out more about his company and where it is headed. Mr. Walbert, welcome to Mad Money.
Well, thanks so much. Great to be on with you today, Jim.
All right, sir, can you tell me what you do that the other guys don't when you get a drug that makes it so that you can have a failed launch, say, of a drug, and then Horizon gets a hold of it and it does great?
Well, Vimuvo is a great example of that, where it did about $20 million in 2013 sales under AstraZeneca, and we're on track to do over $150 million in revenues in 2014. And a lot of it comes to the focus. As a big company, AstraZeneca, a $20 million product doesn't mean a lot. In our hands, that was very important. We put the right focus with our representatives on the product, and we're able to grow prescriptions 18% in the first 3 months that we took the product over. And the first 3 months, we also had about $34 million in revenues paying back in just 3 months. So an exciting acquisition for us, and really sets us up to do further great deals as we did throughout last year.
How does this have to do with your Prescriptions Made Easy initiative?
Well, we really love our PME program, as we call it, Jim, because it does 2 key things. It helps patients, it creates access for patients, and allows them to get our products at the lowest possible cost. In fact, for Vimuvo and Duexis, 2 of our lead products, over 90% of patients pay zero out of pocket of their own cost each month. Secondly, what this program does is it eliminates or significantly reduces the administrative effect for a physician in their office, where they can prescribe Duexis or Vimuvo and get that product without rejection. So if a patient isn't covered by the commercial plan, we subsidize and provide that drug to the patient for free. Our strategy and philosophy is really do the right thing for the patient while we're driving revenues.
All right, let's talk about Actimmune, because the others that you mentioned are, many of them are arthritis drugs or drugs that you take and don't have stomach problems. But Actimmune's very different. That is a classic orphan drug. How do you find patients for that? Because it looks like if you could find a number of them, it would be a giant, giant drug.
Well, we look at this, the acquisition of Videra Therapeutics and bringing Actimmune on board in 2 key ways. First, from a short-term standpoint, Jim, we see an opportunity for well over $100 million drug in its current approved indications of chronic granulomatous disease and osteopetrosis, 2 very rare childhood diseases. We have about 270 patients on drug and see an opportunity to continue to get out via educating patients through advocacy efforts and getting them lined up with the right physicians to help them with these very rare diseases. But most importantly is how we look at it long-term and the opportunity to move into several other additional indications. The most recent coming up is Friedreich's ataxia, a rare neurologic disease, where we expect to begin phase 3 trials here in the Q2 of 2015. In this indication, there's about 4,000 potential patients, 2,400 of them who are well-known, entered into a registry with the key advocacy group. We see the opportunity of this indication alone to be over $500 million annually if the product's approved.
Okay, last question. This Pensad that you got, osteoarthritis of the knee, this has got to be one of the most growing illnesses in the country, given the aging baby boomers. You have 8 issued U.S. patents for protection until April 2022. How big can this one be?
Well, we certainly see this similar to what you mentioned in your opening remarks with what we do with Vimovo. This was a product that didn't have a lot of focus at a larger company where we can bring it on, put a strong sales force effort. We see an opportunity to create multiples of the revenue of $16 million, which it did last year. So significant opportunity to benefit patients, put it into our PME program, which creates the access for the patients, gives them to them at the lowest cost, and clearly we believe that its product profile is equal or if not better than anything else out there. So we're excited about its prospects moving into 2015, and it's off to a great start so far.
Well, that's an absolutely terrific model. I want to thank you so much, Mr. Tim Walbert, the Chairman, President, and CEO of Horizon Pharma, for coming on Mad Money.
Thanks so much for having me, Jim. Appreciate it.
Thank you. This is a very interesting niche company. Remember, we're trying to stay away from companies that are in the crossfire of the dollar and worried about economic activity. This one fits that bill. Stay with Cramer.